People always say that pregnant women have a glow in their face, and I say it is because you're sweating to death. Hi, friends! In our pregnancy exercise series, today I will teach you how to perform squatting exercises. While squatting, the pelvic inlet, outlet, and the canal area at their widest. Those using the squatting type toilet are at advantage as it exercises your joints and muscles without having to do much. Use it more frequently if you have one in the house. Squatting correctly positions a growing baby and the uterus. It also cures constipation. Squatting. While squatting, the pelvic inlet, outlet, and canal are at their widest. Those using the squatting type toilet are at an advantage as it exercises your joints and muscles without having to do much. Use it more frequently if you have one in the house. Squatting correctly positions the growing baby and the uterus. It also cures constipation. Step 1. Squat as when using an Indian toilet. If you are well advanced in pregnancy with a big stomach, follow these steps. Step 2. Stand normally with your bottom touching the wall. Step 3. Now rise on your toes. Step 4. Go down into a squat. Step 5. Do not go into a complete squat. Remain in a slightly raised position. Step 6. Rest your low back against the wall and spread your knees as wide apart as you can. Step 7. Stay for at least 2 minutes in the final position. Step 8. Now go forward on your hands and then your knees to come out of the squatting position. In the 9th month, when the baby is in a head down position, in order to encourage the fixing or the engagement of the baby's head, instead of squatting, one could sit with knees bent and a couple of cushions on one's calves. This position would cause the pelvic structure to be raised to above the level of the knees with a forward tilt to it, so that the angle becomes perfect for the baby to enter the pelvic inlet. This position, called optimal fetal positioning, was advocated by Jean Sutton and Pauline Scott, midwife and childbirth educator from New Zealand. It can be adopted by a woman as she watches TV or when she is sitting on the bed. Precaution. Squatting should not be done by a woman who has had a stitch put on the mouth of the uterus by the doctor, nor by one who is bleeding in pregnancy or who is on bed rest because of a low-lying placenta. Squatting should also be avoided in case of severe or painful varicose veins or piles.